Hi everybody, I'm Dr. Joe from Chiro Health Spa. Today we're talking about what we can do in this office for lower back pain. So let's take a big overview. Lower back pain, there's a lot of different causes to it. Primarily what we look at is the structural causes and the physical causes, because those are the ones that people can have a little bit more control over for some of the lifestyle things that you do. However, sometimes your lower back just gets to a point where you don't feel like there's anything good happening. So let's explain how we approach the lower back problems. Okay, the first thing is we do a in-depth assessment, meaning a consultation and a history. We need to know where you started, where you came from, and all the different things that may have gone on with your back and different injuries that you may have had and different ways that you use your body that ultimately led you to this point. Now, once we do that, we then do an examination. That means that we're going to do things like range of motion. We're going to test your reflexes. We're going to do a neurological exam. We're going to do a chiropractic exam, which means that we're going to put you through some different tests to get an idea of exactly what you can do, how well you can move. Then, if we determine with all of that this is a chiropractic problem, then we start taking action. One of the first things that we do is we take x-rays. Now, x-rays are important for us for a couple of different reasons. Number one, we want to look at the bone structure that you have, just the general, are your bones looking good, or are we looking at things like arthritis and degeneration? The second thing that we want to look at is the space in between to make sure that the disc height, and you've probably heard of, if you've had a herniated disc or you've heard of people that have it, the disc is very simply a shock absorber between the two bones. So what we want to do is see what does that height look like in between the two bones. And then third, we're looking at the overall alignment, or really the posture that you bring to us. So here's somebody with lower back x-rays. The green lines are the normal x-ray, or where the normal structure should be. And in here, so you're looking at the person's back this way, you're looking at the left side and the right side. What you're looking at over here, this is the front, this is the back over here. So the green line is the normal, and the red line is where this person is. So all of those red lines are supposed to be on the green line. So as you can tell, this person's structure and posture are not very good. So now that we see this, we know exactly what we need to do to try to address A, how this person can feel better, but B, what can we do to ultimately improve upon a poor posture? So the very first thing that we look at is what can the chiropractic adjustment do? Now, you may have heard of chiropractic, you may have heard of adjustments. I'm going to give you a little bit of an idea of what our adjustment is because of the fact that we do things a little bit differently. So I want you to think of it that if you think about your posture, I'm just going to walk over here for a second. If you think about posture, what happens with all of us because of the daily things that we do, such as we sit at computers, and unfortunately gravity is working on all of us, what happens is our posture starts to fall forward rather than go backward. I mean, think of a nursing home. You never see people looking up at the ceiling, do you? They're always falling forward. That's gravity working on them. So what our job is to tell your body to learn how to come more upright. So when we're doing our adjustments here, if you've been to a chiropractor many times, you may see that they push on your back and they turn you on your side. My focus with the adjustment here is to literally teach your body a better posture every single time you get adjusted. So that means that actually a lot of it we do standing up. So you would be here, and what I do is I literally do my adjustment this way to help your body get stronger in a more upright position. So that's what a lot of the adjustment actually entails. Really, the adjustment's job is to get the bones moving and to start getting your body into a stronger position. Now, let's say you have pain with your lower back that's been pretty consistent. That's the first focus that we have, is what can we do to actually get rid of the pain before we even look at how we can get you to be in a stronger, better posture. Well, the very first thing that we do is we try to address that with some home stretches. But the second thing that we do, like let's say you're in our office here, we're going to do something called electrical muscle stimulation. Now, you may have heard of electrical muscle stim, as some people may call it. Physical therapists call it that. Really what it is it's this machine right over here. And what we'll do is we'll take two pads, these little sticky pads here, and we'll put them on your lower back. Okay, we'll just put them right there. And all you do is you sit here. And what this is going to do, it's going to feel like a little bit of a massage, but the idea of muscle stim is to actually allow your muscles to get so tired so that they don't stay so tight. I mean, generally with lower back pain, you have muscle tightness because the body has been working so hard to just get to a point where it feels comfortable, and it doesn't ever feel like that. The muscle stim's job is to just relax muscles, and that's what we do. So we sit you here in the very beginning of care to allow that to work. We have this other machine here, it's called cold laser therapy, and what the cold laser does is in cases where it's very significant and very acute with your lower back, we may use this as something to just help reduce inflammation and speed up the healing process. Now, that's the first part of our care. But after that, we have other things that we're trying to focus on, which is, listen, you're gonna feel better, but next, what are we gonna do to get you stronger? And what are we gonna do to get you to a better position for the long term? So that involves a few things. The first thing that we do is we teach your body to stretch in the opposite direction so that you get what's called a better mirror image posture. So let's take that person for example. One of the things that we're going to be looking at is that person cannot stay with that structure because ultimately that structure is going to weaken. So that means we want to get the person to be stronger in the opposite posture of what their x-rays are showing. So let's take that person as an example. If you remember on the x-rays, their x-rays were showing that they were going off to the left and they had a curvature. So our job is then going to be, what can we do to strengthen the opposite? Well, let's do something like this. We might teach them a stretching exercise, a strengthening exercise, that will teach that body to go to the right and tilt, let's say. So everybody's posture is a little bit different. So nobody's really going to get the same exercises in our office because no two postures are the same. In this person's case, this is what we would have them do. We would teach them this exercise so that ultimately their body is getting stronger in the opposite posture and not just staying as a weak posture. So it requires the muscles to get stronger. So that's one of the things that we would have you do in office, for example. And we would look at your front posture and we would say, okay, well, if that posture is not good, then we would give you exercises for that one as well. So those are some of the things that we do in office. Now, for people that have more of a acute thing going on, as far as, let's say, if you've had a herniated disc, we may have to do something called spinal decompression. That's what this is right here. Now, spinal decompression's job is very simply to create an environment for the bones and the discs and the nerves so that they're more relaxed. So what we're going to do is we're going to open this up. So what you're seeing here is literally a machine that's literally just going to open and close, open and close. So a lot of you that have had herniated discs, if you've had one of those, if you've had a bulging disc, if you've had any kind of real significant long-term tension in there, one of the therapies that we'll use is decompression to really get that spine to open up, give those nerves breathing room, and allow for there to be a better relaxation. This is really significant with anybody that's had a herniated disc. We've helped a lot of people with spinal decompression. And as you can see, it's not very difficult. You just lay there, and all that does is it just stretches you. So it really feels fantastic. Does it feel fantastic?
Feels fantastic.
There you go. So now let's go back into a little bit more of a posture thing. So now as we're talking about what are we going to do to strengthen a good posture, let's go back to those x-rays that we talked about originally. We have to teach your body not only to get stronger from the muscle part that I showed you with the exercises that I showed you earlier, but we also have to teach the bones and the ligaments to move that way too. So let's say in a case like those, that person needed to get their spine to push more to the center. So we have a table here where what we'll do is we might lay you on your side, and we might use this to lay right underneath where that curvature is. So that person that you're looking at on their x-rays there has a scoliosis. This is something that we would do for scoliosis, for example. We would put this block in there and we would have them lay down, and automatically it's pushing into the opposite direction. You can tell that this block right now is going to help move those bones. And every time that you're here, our job is going to be, what can we do to create a better opposite posture? Well, this is one of the tables that we use. We would actually use some straps in here. We would lay you down on this and allow this block and those straps to move your posture into a better position just by using the different things that we have in here. Okay, so this is one of them. Now, as we saw with the other person that's on those x-rays, they also have a posture that's going backwards too much. So another therapy that we might use is one like that's over there. That's called a target force. It's not a guillotine. I know a lot of people look at that and say, wow, that looks scary. But really what it is, it's something that if you have a posture that wants to do this, like a lot of us do anymore from slouching and computers, what this is going to do is it's going to help pull you into a better position and ultimately get your rib cage to sit more over your hips. All right, so all of these different things in here are geared toward either one phase of care, which is getting you out of pain and getting you to feel better, or the second really important phase and where your healing really begins is to restructure your posture to get you to a better point. We do not want you to strengthen a bad structure. We want you to only strengthen a good structure. So that's the most important thing that we can do, is get that structure in as good as it can be so that your long-term health gets better and better and better. All right. So if you know anybody that's had lower back pain, if you have it yourself, this is a really important video to kind of give you an overview of what we do. Please share this video, feel free, because you may have seen some things on here that you have never seen before. And that's where we can come in, is really to try to really get this posture to be a better position for you all the way for the long term, okay? I hope this helps. I'll see you on the next video. Thank you very much.